As we head towards July 1st, it's a big day in Georgia every year. It's when many, not always, but most of the new laws passed by the state legislature and signed into law by the governor go into effect. And that means there's a major change to Georgia's medical cannabis program that's going to take effect tomorrow, July 1st. Important rules that you've got to know before heading to a dispensary. We're going to talk about them right now. We are joined by Dr. Tiffanni Forbes and Judson Hill of Fettle Dispensary. Thank you both for being here.
Thank you for having us.
Judson, let's start with you. When we talk about the industry here in Georgia, the medical cannabis industry, it has been kind of on a growth trajectory for the past few years. What does this new law going into effect do for the industry?
Well, simply put, it makes Georgia the 41st state to have a true medical cannabis program. So we're definitely not first, but we're closing out the last 10 here and excited about tomorrow.
41st, that doesn't mean we're last. We're not
Right.
50th. And Dr. Forbes, for patients, because as Judson points out, our system is different than other states here. You have to get certified.
Correct.
That's where you come in. You're
Yes.
a certifying physician. What does that process look like, and what impact does it have for the patients that you meet?
Absolutely. So in order to receive medical cannabis here in the state of Georgia, you have to be a resident of the state of Georgia. You have to be able to show that by having either an active driver's license or an ID. In addition, there are some qualifying conditions that you do have to abide by here in the state. Currently, we have about 18, July 1st tomorrow. Some of those qualifying conditions will expand. And so it's with the expansion of the process in the program, we will be able to touch a lot more Georgians for patients for medical cannabis here.
And Judson, you alluded to this, but Doctor, if I'm hearing y'all right, at bottom what this does, SB 220, is it expands the number of people and the number of conditions that qualify people for access. Is that right?
Yes, and it expands the types of products, so it's really twofold. We can now sell flower, which is a traditional form of cannabis people are used to, and then vaporizers. So before that, it was just low THC oil products. Those have much more efficacy and affect you quicker. So people that are going through epileptic seizure or whatever it may be, they need relief immediately, not something that kicks in an hour. And then it also expands who can access it by removing the severe end-stage qualifier, which means people can get this treatment sooner, where before they had to be at the end of life. So it was really a way to help them ease their final days rather than treat the condition.
There's also a business impact to this, an economic impact. And Judson, I want to ask you more about that in a moment. But Dr. Forbes, let's talk about the impact to the patients. What kinds of impact do you see when you're able to certify somebody and see them get on and legally be using medical cannabis here in Georgia?
Yeah, so we have so many different qualifying conditions. Currently, the most that we see here in the state of Georgia that I see as a certifying physician is intractable pain. We will be able to reach a tremendous amount of people that are having pain for whatever reason, be it rheumatoid arthritis, sickle cell anemia, cancer pain. All of those things are now open to our patients here in Georgia to receive medical cannabis as either a primary treatment or either an alternative or a treatment in conjunction to what they're already receiving. There's so many medical treatments that are available with cannabis that we can provide for now patients and a greater population of patients here in the state of Georgia.
There was a time not too long ago in Georgia where this was a non-starter.
Absolutely.
And it's not ancient history that was the case. Do you feel, Doctor, that there is still some opposition to medical marijuana in Georgia?
I think that there is a lot of room for education, not just opposition. I think it's been taboo for so long. And we know that federally, even some of the laws are changing over time. So I think it just leads for us to educate more, not just the patients, but also pharmacists and the medical community itself. about the uses of cannabis. Certainly, the fear is that this will be abused. But with the right type of education, the right type of, patient-physician relationship, it certainly is something that is very beneficial.
And Judson, for your business and others like it, Fine Fettle Dispensary is yours. You've got shops all across the state already now, right?
Yes, sir.
What happens to your bottom line and to others who are in your field, because you are a business too, after July 1st, which is tomorrow, this new law goes into effect, and it seems like would expand not only the people who are eligible, but also potentially your TAM, your total addressable market here.
100%. I mean, I'm born and raised in Georgia, but I've worked in the industry in other states. So we're really at the ground level. Personally, we think that we could employ up to 200 people at our Macon facility. So it'll be a huge driver for communities that currently need new jobs and new industries. Also, from the market standpoint, it's about 35,000 patients across Georgia right now, where we have 11 million people in the state. So it's 0.02% of the population. For context, Florida has 1 million patients. We expect it to be closer to 200 to 250,000 Georgians have a card, would be more in line with other medical programs. And I don't think there's less sick Georgians. There just has been less knowledge and less accessibility for the program today.
And those figures, those are eye-opening. The difference between, I think you said 38,000 right now to 200 to 250,000, that's I don't want to do math live on air here, but that's a 5, 6, 7, 8x maybe growth range there. If I'm hearing right, is what you're saying after tomorrow, that 200, 250,000 number, that's who's going to be potentially eligible?
I mean, it'll probably take a year or two to Dr. Forbes' point, the word to get out. I mean, more physicians have to become aware of the program in order to be able to speak to it and recommend it to their patients. To date, there's been a lot of red tape with some of the larger healthcare systems in Georgia for obvious reasons, but recently the federal government just rescheduled medical cannabis, so it's now a federally legal drug. And with this change in Georgia, I think we're set up for a lot more access and knowledge about medical cannabis here.
And Dr. Forbes, Judson teased you up really well here, which is not a surprise. You guys came in as a team, which is great, and we appreciate it. But this is an alternative in many cases to other kinds of, as you pointed to, pain is the most frequent reason that you see people coming forward and trying to get certified. There are pain medications you can take. Mm-hmm. We've seen a lot of reporting in recent years about the downsides of that. You look at opioids use as pain treatment devices. There's some downsides to that. What would be your message to other physicians out there who are in pain management? They have patients coming to them. What would you say to them?
I would say to keep an open mind. It certainly is something that could be a great addition to the medications that you're already using. It's perfect for those patients that have been on opioids for a long period of time and are looking for other ways of getting off of opioids. And so there's just a great many of things that you can do with cannabis, that you can use it as needed for emergent relief. That's one of the new things that having the pulmonary inhalants or the vape products, because they can give you that immediate relief while you're waiting for your other medications to kick in. And so keeping an open mind, talking to other physicians such as myself that are certified and are very aware of how the medications work. Certainly, again, like I said, there's potential for education across the board, not just for our patients, but for also other healthcare providers.
We're short on time here. We've got about a minute left. Judson, I want to ask you this before we go. Obviously, I want to be respectful of your time. But for somebody who's maybe watching this, maybe they're on the fence, maybe they are dealing with a chronic condition or something that is leaving them in pain or dealing with some other condition that they think, perhaps this might be a new avenue to better control, better treat what's going on. But there's somebody who's, they've never used marijuana before, they've never used medical cannabis. This is like a totally foreign conversation to them, but they're looking for treatment. What would be your message to that kind of person?
Well, I'd invite them to come out to our stores, and we're in Smyrna, Decatur, Athens, and Evans. We'll be having Dr. Forbes at our Decatur location tomorrow, so we really offer education both from physicians and our staff on what types of products to use for what conditions, and then you can visit us online as well. Telemedicine is available in Georgia, so it's actually pretty easy to set up an appointment and talk to a doctor that's knowledgeable on it and see if it's right for you.
And more people are going to have the opportunity to have those conversations starting tomorrow. We are out of time, guys. Thank you so much, Dr. Tiffanni Forbes and Judson Hill of Fine Fettle Dispensary. Thank you both for your perspective and your time ahead of a big day in Georgia.
Absolutely.
Thank you.
Thank you.